There is a moment that happens quietly in the body after 60, and most people never feel it. The same pill you've been taking for years, the one your body tolerated without any issue, can suddenly begin to behave differently. Not because the pill changed, but because your body did. And in some cases, that difference is not small. It can mean the difference between protection and risk, between stability and a slow buildup towards something much more serious, like a heart attack or stroke. What makes this especially dangerous is that nothing feels wrong at first. No warning sign, no pain, no clear signal, just a silent shift. And today, we're going to talk about 5 specific types of medications that after the age of 60 have been linked to an increased risk of cardiovascular events, especially when certain conditions are present or when they're taken the same way they were years earlier. But here's the part that matters most. This is not about fear. This is about understanding what's actually happening inside your body so you can make better decisions moving forward. My name is Dr. William. I'm a medical doctor and physician, and on this channel, I break down complex health topics into clear, practical explanations so you can better understand what may be happening inside your body and what actually makes a difference over time. If you find this kind of information helpful, you can subscribe, but more importantly, stay with me through this, because one of the medications we'll talk about today is taken daily by millions of people and almost never questioned. Now, to understand why these risks increase after 60, you have to start with something most people are never told. Your body does not process medications the same way it used to, and this is where things begin to change. As we age, several systems in the body start to slow down. The liver, which is responsible for breaking down many medications, becomes less efficient. The kidneys, which filter waste and excess substances from the blood, also lose some of their filtering capacity. That means drugs stay in your system longer, sometimes much longer than expected. And when that happens, even a normal dose can begin to act like a higher dose over time. But that's only part of the story. There is also a shift in how your blood vessels respond. Your arteries become less flexible. The inner lining of your blood vessels becomes more sensitive. Circulation patterns change, and the balance between clotting and bleeding becomes more delicate. So, when a medication interacts with any of these systems, the effect can be amplified. And this is where people get misled. Because the medication itself is not necessarily dangerous, it may have been completely appropriate when it was first prescribed. It may still be useful today, but the context has changed. And medicine, more than most people realize, is all about context. The same drug can be helpful in one situation and risky in another. The same dosage can be appropriate at 50 and excessive at 70. And yet, in real life, prescriptions are often continued for years without being reevaluated in detail. Not because doctors don't care, but because these changes happen gradually, quietly, in the background. Now, here's where it becomes more serious. After 60, the risk of cardiovascular events like heart attack and stroke naturally increases. That's a known baseline risk. But when certain medications are layered on top of that, especially without adjustment, they can push that risk higher. Sometimes subtly, sometimes significantly, and often without any obvious symptoms until something happens. That's why today's topic matters, because we're not just talking about medications, we're talking about how your body interacts with them right now, at this stage of life. And more importantly, what you can actually do about it. Now, before we go into the first 2 medications, there's one important idea you need to keep in mind. None of what we're about to discuss means you should stop any medication on your own. That's not the goal here. The goal is awareness. Because when you understand how something works, you can ask better questions. You can have more informed conversations, and you can avoid staying on autopilot with something that may need adjustment. And this is where the first layer of risk begins, because the first 2 medications we're going to talk about are among the most commonly used, especially after 60. They're often taken daily, they're widely considered safe, and yet, under certain conditions, they can quietly increase strain on the heart and alter blood pressure in the wrong direction, or affect how blood flows through already sensitive vessels. And once you see how that happens, you'll start to understand why this is not just about the pill itself. It's about timing. It's about dosage. It's about how your body has changed. And that's exactly where we're going next. Let's start with something very common. A medication that many people take without a second thought, often for years, sometimes even decades. And yet, after 60, it begins to behave very differently inside the body. The first one is a group of drugs known as nonsteroidal anti-inflammatory drugs, or NSAIDs. This includes medications like ibuprofen, naproxen, and even some prescription-strength anti-inflammatory drugs. They are widely used for joint pain, back pain, arthritis, and everyday inflammation. And for many people, they feel like a simple solution. You take one, the pain eases, and you move on with your day. But inside the body, something else is happening. NSAIDs work by blocking certain enzymes involved in inflammation. That's what reduces pain. But those same enzymes also play a role in protecting your blood vessels and maintaining proper blood flow. And this is where the issue begins. After 60, your blood vessels are already less flexible. The inner lining of your arteries becomes more sensitive to stress. When NSAIDs interfere with that protective system, it can lead to a subtle tightening of blood vessels. That tightening increases blood pressure, and not always in a way you immediately notice. It can be gradual, quiet, but persistent. At the same time, NSAIDs can affect how the kidneys regulate fluid balance. They can cause the body to retain more sodium and water, and that creates additional strain on the heart. Now you have two things happening at once: increased blood pressure and increased fluid load. And for someone whose cardiovascular system is already working harder after 60, that combination matters a lot. There have been multiple large-scale studies showing that long-term or frequent use of NSAIDs is associated with an increased risk of heart attack and stroke, especially in older adults or those with existing cardiovascular risk factors. And this is where people get misled, because the relief is immediate, but the impact builds slowly. You don't feel your blood pressure rising in real time. You don't feel the added strain on your arteries day by day. But over time, it accumulates. Now, here's a key point. This does not mean NSAIDs are bad. It means they need to be used with awareness. Short-term use, occasional use, carefully monitored use may still be appropriate. But daily, long-term use without reevaluation after 60, that's where the risk begins to increase. And that brings us to the second medication, because this one is even more subtle and even more underestimated. It's a class of drugs called proton pump inhibitors, often referred to as PPIs. These include medications like omeprazole, esomeprazole, and similar acid-reducing drugs. They are commonly prescribed for acid reflux, heartburn, and stomach protection, especially in people who take other medications that may irritate the stomach. And on the surface, they seem harmless. They reduce acid, they relieve discomfort, they protect the stomach lining, but this is where things become less obvious. Stomach acid is not just there to cause discomfort. It plays a role in absorbing key nutrients, especially magnesium, calcium, and vitamin B12. And over time, long-term use of PPIs can reduce the absorption of these nutrients. Now, that may not sound directly related to heart attack or stroke, but it is. Magnesium plays a critical role in heart rhythm stability. Low magnesium levels can increase the risk of irregular heart rhythms. Calcium balance affects vascular function, and vitamin B12 is involved in maintaining healthy blood vessels and nerve function. When these levels are disrupted over time, the cardiovascular system becomes more vulnerable. But there's another layer. Some research has suggested that long-term PPI use may affect the function of the endothelium, the inner lining of blood vessels. And that lining is essential for controlling blood flow, clotting, and vessel relaxation. When it doesn't function properly, the risk of vascular events increases. Again, this doesn't happen overnight. It builds slowly, quietly, and often without clear symptoms. Now, here is where people get this wrong. Many individuals are started on a PPI for a short-term issue, like acid reflux or stomach irritation, but then continue taking it for years without reassessment. Because it feels safe. Because it was prescribed. Because nothing seems wrong. But the longer it continues without review, the more the underlying effects begin to matter. And this is where awareness changes everything. Because sometimes the solution is not stopping the medication completely. It may be adjusting the duration, reassessing the need, or exploring whether a lower dose or alternative approach is appropriate. But that only happens when the question is asked. Now, what we've covered so far is just the first layer. Two very common medications, two mechanisms that quietly increase cardiovascular strain over time. But what comes next is where things begin to go deeper. Because the next two medications don't just affect pressure or nutrient levels, they interact directly with how your heart functions, how your blood moves, and how your system responds under stress. And once you understand that part, the picture becomes much clearer. Now, this is where things start to shift from subtle to something much more significant. Because the next two medications don't just influence blood pressure or nutrient levels, they interact directly with how your cardiovascular system behaves under stress. And in many cases, the effects are not immediate. They build slowly over months, sometimes years, which is exactly why they're so often missed. Let's start with the third one, a class of medications commonly used for sleep, anxiety, or calming the nervous system. These are known as benzodiazepines. Examples include diazepam, lorazepam, and similar medications. They are effective. They can reduce anxiety quickly. They can help with sleep. And for many people, especially later in life, they feel like a necessary support. But here's what's happening underneath. Benzodiazepines act on the central nervous system. They slow brain activity, which creates that calming effect. But they also slow down other systems in the body, including breathing, reaction time, and coordination. Now, you might wonder, how does that connect to heart attack or stroke risk? This is where the mechanism becomes important. As we age, the body becomes more sensitive to these medications. They stay in the system longer, they accumulate more easily, and their sedative effect becomes stronger even at the same dose. Over time, this can lead to reduced physical activity, less movement, and more time spent sitting or lying down. And that matters more than most people realize, because circulation depends on movement. When movement decreases, blood flow becomes less efficient. The risk of clot formation increases, and oxygen delivery to tissues becomes less optimal. But there's another layer. Benzodiazepines can also affect breathing patterns during sleep. They can contribute to shallow breathing or worsen existing sleep-related breathing issues like sleep apnea. And when oxygen levels drop repeatedly during the night, even slightly, it puts additional strain on the heart. Now, you've a combination: reduced circulation, lower oxygen levels, and increased vulnerability in an aging cardiovascular system. And again, this doesn't feel dramatic. It feels like fatigue. It feels like slower mornings. It feels like normal aging. But underneath, the system is under more stress than it should be. And this is where the long-term effect begins to matter. Because over time, these small changes can contribute to a higher risk of cardiovascular events, especially when combined with other factors like high blood pressure or existing vascular disease. Now, here's something most people don't realize. The risk is not just from taking the medication. It's from taking it continuously without reassessment as the body changes. And that brings us to the fourth medication. Because this is where things become even more complex. Not because of what the drug does on its own, but because of how it interacts with everything else. The fourth category is certain decongestants and stimulant-like medications. This includes drugs containing pseudoephedrine and some combination cold medications. These are often used for sinus congestion, colds, or seasonal discomfort, and they are easy to access. Many are available over the counter, which makes them feel safe. But their mechanism is very different. Decongestants work by constricting blood vessels. That's how they reduce swelling in the nasal passages, but that effect does not stay limited to the nose. It affects blood vessels throughout the body, including those connected to the heart. When blood vessels constrict, blood pressure rises, heart rate can increase, and the heart has to work harder to push blood through a tighter system. Now, in a younger body with flexible arteries, this effect is usually tolerated. But after 60, when arteries are already less elastic, that added constriction can become significant, especially if someone already has high blood pressure or is taking medications that affect cardiovascular function. And this is where combinations become dangerous, because many people do not take just one medication, they take several. A blood pressure medication, a pain reliever, something for sleep, and then, during a cold or allergy season, a decongestant is added on top. Individually, each one may seem manageable, but together they begin to interact. One raises blood pressure, another affects fluid balance, another slows the system down, and the body has to compensate. Now here's where people get caught off guard because the trigger event, the moment something happens, often seems sudden, but the buildup has been there for a long time. This is what makes these situations so misleading. It feels like it came out of nowhere, but in reality, it was a gradual accumulation of stress on the cardiovascular system. And this is why awareness matters more than anything else, because when you understand how these medications interact, you start to see patterns. You start to recognize when something may not be working in your favor anymore. And that's where the next part becomes critical, because there is one more medication. And this one stands out, not because it is rare, but because it is incredibly common, widely used, and almost never questioned. And once you understand how it affects the body after 60, it changes the way you look at it entirely. Now, this is the one that tends to surprise people the most, not because it's obscure, not because it's rarely used, but because it's everywhere. Taken daily, trusted, and often assumed to be completely harmless. And yet, after 60, the way it interacts with your body can quietly shift in a direction that increases cardiovascular risk, especially when it's used without regular review. The fifth medication is low-dose aspirin. For years, aspirin was widely recommended as a simple way to protect the heart. A small daily dose, often called baby aspirin, was thought to help prevent heart attacks and strokes by reducing blood clot formation, and in certain situations, that is still true. For people who have already had a heart attack or a stroke, or who have specific high-risk conditions, aspirin can play an important protective role. But here's where things changed. More recent research has shown that for many adults over 60 who have not had a previous cardiovascular event, the routine use of aspirin may not provide the benefit people once believed, and in some cases, it may actually increase risk. Now, let's break down why. Aspirin works by reducing the ability of platelets to stick together. That helps prevent clots from forming inside arteries. But clotting is not just something harmful. It is also a protective mechanism. Your body uses it to stop bleeding when vessels are damaged. After 60, blood vessels become more fragile. The lining of the digestive tract becomes more sensitive, and the balance between clotting and bleeding becomes more delicate. So, when aspirin reduces clotting ability in this context, it can increase the risk of internal bleeding, especially in the stomach or brain. Now, you might wonder, how does that connect to stroke or heart risk? This is where the nuance matters. There are two main types of stroke, one caused by a clot-blocking blood flow, and another caused by bleeding in the brain. Aspirin can reduce the risk of clot-related strokes, but it can increase the risk of bleeding-related strokes. And after 60, especially without a clear cardiovascular history, that balance can shift. In some individuals, the bleeding risk begins to outweigh the protective benefit, and that's exactly what more recent clinical guidelines have started to reflect. Now, here is where this becomes even more important. Many people started taking aspirin years ago based on older recommendations and simply continued. No change, no reassessment, because it felt like a safe preventive habit. But medicine evolves, and what was once standard practice is not always the best approach today. This does not mean aspirin is bad. It means it is specific. It must be matched to the right situation, the right risk profile, the right individual. And this is where understanding your own context becomes critical. Because taking aspirin just in case, without knowing whether it truly benefits you, can create a situation where risk is added without meaningful protection. Now here is the shift that matters. Up to this point, we've talked about 5 medications, each with a different mechanism, each affecting the body in a different way. But they all share something in common. Their risk increases when they are taken the same way, despite the body changing over time. And this is where control comes back to you. Because the most important step is not stopping everything. It's understanding what needs to be reevaluated. So, here are a few practical things that actually make a difference. First, review your medications regularly, not just when something goes wrong, but proactively. Ask your doctor or pharmacist, do I still need this at the same dose? Has my risk profile changed? Is there a safer alternative at my current age? Second, pay attention to combinations. Many of the risks we talked about are not from a single medication, but from how multiple drugs interact. Even over-the-counter medications, even occasional use. Everything counts. Third, watch for subtle signals. Not dramatic symptoms, but small changes. Increased fatigue, shortness of breath, unusual dizziness, changes in blood pressure readings. These are often early indicators that something needs adjustment. And finally, understand that your body is not static. What worked 10 years ago may not be ideal today, and that's not a problem. It's simply part of how the body evolves. Now, what we've covered so far gives you a clear picture of where the risks can come from. But the most important part is still ahead, because understanding the problem is only one side of it. What truly matters is what you do with that information moving forward, and how you use it to protect your health in a way that is practical, realistic, and grounded in how your body actually works today. If there's one thing to take away from everything we've just covered, it's this. The real risk is not the medication itself. It's taking it the same way while your body is no longer the same. Because after 60, your body is not simply an older version of what it used to be. It functions differently. It processes substances differently. It responds differently under stress. And most importantly, it tolerates imbalance less easily. That means even small mismatches, small excesses, and small interactions can have a larger impact than they once did. And this is where many people unknowingly fall into a pattern. They continue what has always worked. They trust what has always been prescribed. They follow the same routine day after day, year after year, not realizing that the context has shifted. And this is not about doing something wrong. It's about something that was never clearly explained. Because in medicine, there is a concept that doesn't get talked about enough. Not everything needs to be added. Sometimes things need to be adjusted, reduced, or reconsidered. And that process is just as important as starting a treatment in the first place. Now here's where this becomes empowering rather than concerning, because once you understand this principle, you start to see your health differently. You stop looking at medications as fixed, permanent solutions, and you begin to see them as tools. Tools that need to be used at the right time, in the right way, for the right stage of life. And when that alignment is correct, they can be incredibly helpful. But when that alignment drifts even slightly, that's where risk begins to build. Now think about the 5 medications we discussed. Pain relievers, like NSAIDs, helpful for reducing inflammation, but capable of increasing blood pressure and fluid retention when used long-term. Acid-reducing drugs like proton pump inhibitors, useful for protecting the stomach, but capable of affecting nutrient balance and vascular function over time. Benzodiazepines, calming the nervous system, but potentially reducing movement, altering breathing, and affecting circulation. Decongestants, clearing the sinuses but tightening blood vessels and raising cardiovascular strain. And aspirin, protecting against clot formation in the right context, but increasing bleeding risk when used without clear indication. Each one has a purpose. Each one has value, but each one also has a threshold, a point where the balance can shift. And that point is not fixed. It moves with age, it moves with changes in your body. It moves with other medications, with lifestyle, and with underlying conditions. And that's why awareness matters more than anything else, because awareness leads to better questions, and better questions lead to better decisions. Now, here's something simple, but incredibly powerful. At your next medical appointment, instead of only focusing on new symptoms or new prescriptions, ask this: is everything I'm currently taking still appropriate for me at this stage? That one question changes the conversation. It shifts the focus from adding to evaluating, from reacting to optimizing. And often it opens the door to adjustments that reduce risk without removing necessary support. Because again, the goal is not to remove everything, it's to make sure everything you're taking is still working in your favor. Now, another important point. Your body gives signals, not always loud ones, but consistent ones. And learning to notice them can make a real difference. Subtle increases in fatigue, a sense that your energy drops faster than it used to, lightheadedness when standing, shortness of breath during activities that once felt easy, changes in sleep quality. These are not always dramatic, but they are meaningful. They are often the early signs that something in the system needs attention. And when you combine that awareness with regular review, you create a level of control that most people never develop. Now here's where everything comes together. The difference between reacting to a heart attack or stroke and preventing one often comes down to small adjustments made early. Not one big change, not one dramatic intervention, but a series of small, informed decisions that keep your system balanced over time. And this is where you have more influence than you might think. Because while you may not control every risk factor, you do have control over awareness. You do have control over asking questions, And you do have control over making sure your current routine still matches your current body. That's what makes the difference. Not fear, not avoidance, but alignment. Now, if this helped clarify something for you, or made you look at your routine a little differently, consider staying connected to the channel because this is exactly what we focus on here. Not quick fixes, not exaggerated claims, but clear, practical understanding of how the body actually works and what truly makes a difference over time. And if you know someone who is taking medications daily, especially after 60, sharing this with them could make a real impact because sometimes the most important changes start with a simple realization that what worked before may need to be looked at again. And once you see that, you start making decisions in a completely different way.